everyone. Welcome to the Be Better Show. On the Be Better Show, which is sponsored by Quint Clinic, I help patients to be better. I'm Dr. Catrice Brooks, a board-certified family and lifestyle medicine. And today we have a wonderful guest, a great friend of mine, Dr. Celine Lee. She is a wonderful rheumatologist. She's based out of Utah. Let me give you guys her bio. Lee is a board-certified rheumatologist who's practiced in the suburb area of Salt Lake City. She has a unique background of also being board-certified dermatologist. Dr. Lee graduated from Korea University of South Korea and completed her dermatology residency at the National Medical Center in South Korea. While working as a board-certified dermatologist in South Korea, she encountered many patients whose skin diseases provided clues to discover deeper internal medicine problems, especially autoimmune disorders and rheumatological diseases. She came to the United States to further this study and obtain board certifications in internal medicine and rheumatology. And thanks to her profound experience in dermatology, internal medicine, and rheumatology over the past 20 years, she has a unique ability to be able to recognize subtle cues that lead to the discovery of root causes of various symptoms. That's what I'm about, which helped many patients solve their mystery diseases and finally start treatment. She also became interested in how our daily lives, such as diet, sleep, and stress, affect autoimmune diseases and our overall health, and counsels her patients about this routinely. She's so passionate about this field that she became board certified in lifestyle medicine. Her journey as a physician has been about discovering the root causes of various symptoms and finding the best solution that uses only essential medicines the patient really needs, and helping the patients harness their own body's natural healing power by developing healthy lifestyle habits. With her broad expertise in 4 different specialties, she can see the bigger picture of a person's health and find a true solution to the root cause rather than looking just at individual symptoms. Dr. Lee treats her patients as a whole person rather than merely fixing a disease. Welcome, Dr. Lee.
Thank you so much for inviting me to your show.
I'm so happy to have you. You are just like me, where I'm very interested in the root causes of disease and the things we do day to day to affect our overall health. So I just think that, we come from similar backgrounds and mindsets. And I know that my patients, family, and friends would benefit so much from your expertise. So happy to have you. So first, we're going to dive into what is rheumatology. And that's kind of a question that many people have. I think I have that. So before I got into med school, I don't even know if I was clear on, what's rheumatology, what's a rheumatologist, even though it's literally one of the oldest specialties in medicine, right? Hippocrates talked about rheumatism and rheumatology, and with the ancient Greeks. And so rheumatology, we think of as the study of, or not the study of, but the treatment of joint disorders, skin, muscle, and joint diseases, and especially how it interacts with inflammation and autoimmune disease. How's that for you, Dr. Lee? Would you want to clarify anything about what I said with rheumatology?
Yes, you explained very nicely. It is a disease that causes inflammation in our body. It comes from actually from our own immune system, not coming from other external sources. It can be triggered by external sources such as infection, for example, or smoking. But it is caused by our own immune system. So our immune system is designed to help us to thrive against all these external threats, such as bacteria, allergy, virus, whatnot. But the autoimmune disorder of rheumatology, they're kind of a little bit confused in recognizing who is enemy and who is ally, and it mistakenly attack our ally with our own tissue. It can be joints or skin or kidney or lung. It can basically go all these organs because our immune cells are everywhere. So it is a disease where our immune system is a little bit dysfunctional and a little bit too overly protective, and it actually causes inflammation too much to the point that it can harm ourselves.
Awesome. So rheumatology is the study of, or the study and diagnosis and treatment of autoimmune diseases where your body is attacking itself and causing inflammation.
That's correct.
Awesome. Very good. So typically, as a family doctor, I treat some, rheumatological conditions, or I do some of the early diagnosing of people where we start to suspect maybe there's an autoimmune condition or some inflammation. But when should a patient come and see you? When do they need to see a rheumatologist, a specialist in this area?
So a lot of patients who have autoimmune disorder, they usually have some sign of inflammation. The really common thing is a joint pain and swelling. So a lot of time that they will see their primary care doctor for these symptoms. And the primary care doctor will start the evaluation. Oh, is there something rheumatologic or this is something else? And one of the things that can differentiate what is inflammatory symptom and what is just regular pain is the fact that inflammatory pain usually gets worse with immobility and worse when you're resting. As opposed to the mechanical pain, you have
Mhm.
more joint pain when you do a lot of things. So you have a lot of joint pain after you're using your hands a lot, after doing a lot of DIY projects for your home, that you have a hand pain. If you went to hiking and you hike like 7 miles, you could have knee pain and ankle pain. And those pain will come after overuse of those joints and will get better with resting. But inflammatory arthritis is the opposite in that it gets worse when you're resting. So that's the reason why often it's the worst symptom is in the early morning, such as 5 a.m., 6 a.m. People can wake up with this joint pain and stiffness. They cannot move their joints very well, and they often describe it like I feel like a tin man and I cannot move. And it takes a long time for them to recover from the stiffness, usually more than 1 hour. So if the patients complain of this kind of pain, which is a different than the mechanical pain, then that's when the patient needs to see a rheumatologist.
Awesome. That is such a great explanation. You touched on, pain worse in the morning, pain that is worse with rest. That is such great gems. I know that you're also a board certified dermatologist as well as lifestyle medicine, and we'll touch on both of those a little. But how does your practice or knowledge of dermatology inform your practice of rheumatology? How do the two interact with our skin and these autoimmune conditions?
Yeah, so actually my interest in rheumatology came from dermatology. So I used to be a board certified dermatologist in South Korea, where I saw a lot of patients with skin disorders came to me because it was skin rash, so they thought it's a dermatology problem. So I examined the patient and then do some blood tests and biopsy, things like that, and it actually turned out to be rheumatologic disorder. So I saw a lot of lupus rash, psoriasis that causes psoriatic arthritis, scleroderma, which causes skin thickening, dermatomyositis also cause rashes around the eyes and over the knuckles. So a lot of this, the skin findings was actually just the tip of the iceberg that signal there's something deeper. So I was so fascinated how this little sign of the skin, a little rash over the knuckles, and little like scales around the scalp will actually signal there's bigger problem inside. And I was always, I was always about the root cause. So I kind of felt that, oh, I really want to treat the whole person rather than focusing on the skin findings. So I decided to learn rheumatology, and that's why I'm a rheumatologist now. So it actually came from dermatology and evolved into my rheumatology career.
Awesome. I love that you mentioned all of those conditions that have associated skin findings, the lupus, the dermatomyositis, Sjogren's, all of them with skin conditions. So that is awesome. You also mentioned that you are lifestyle medicine, and all of those conditions are there's some inflammatory inflammation that's underlying the condition. What can we do lifestyle medicine wise? The 6 pillars of lifestyle medicine with diet, exercise, sleep, stress management, avoiding smoking, and connection. Out of those pillars, or what can we do to help if we have autoimmune conditions or if we want to prevent autoimmune conditions?
Yes. So, although that, autoimmune disorder have some genetic component, but we can still do a lot of things in our daily life and we still have control and we can still be empowered about what we can do in our daily life because there are a lot of things in our life that can trigger inflammation and also they can prevent inflammation. So it is very important that in our daily life, we need to try to decrease the inflammatory life habits as much as possible and increase anti-inflammatory life habits as much as possible. For example, smoking is one of the known risk factor of causing rheumatoid arthritis, to the point that the people who smoke can develop RA more than 4 times than the normal population. So it is proven that there's a certain things that can cause inflammation in our life, and there are certain foods that can be more associated with inflammation, such as highly processed food, just like a lot of fast food. They use a lot of saturated fat, for example. Highly processed grain like white flours or white rice. Those are not that good. And too much of animal food. So if you eat too much of the red meat, here and there is fine. But if you eat it like every day, there might be fueling into inflammation, especially the red meat that was cooked by direct heat and charred. That's cause a lot of inflammation. And too much of salt can cause a lot of swelling too. So those need to be avoided. Sleep is very important because during sleep, our body try to maintain our balance in our body. So if you lose sleep and your sleep is not good, then your body just cannot recover from the previous day's stress and all this inflammatory process. So it's very good, important to have a good sleep. So by doing those things, we can decrease the risk of causing inflammation. And also, there are certain things that is known to decrease inflammation, such as dark green vegetables, cruciferous vegetables like broccolis, cauliflowers, berries such as blackberry, strawberry, blueberries, all those berries. So those are good to have in our dish. And also, the recent study from Harvard University showed that vitamin D and fish oil can actually may prevent the development of autoimmune disorders. So it's very important to have enough vitamin D to make sure that you have some good vitamin D source, such as fatty fish and adequate sun exposure, things like that. And also, the fish oil, you can have some just natural fish by just eating fish. You can get it like that. Or if you don't eat fish for some reason, then you can also take the supplement. But those two, vitamin D and fish oil, have been to be effective for autoimmune conditions.
Awesome. So many gems in there. You just give so much information. That was wonderful. So I just want to reiterate, we want to avoid processed foods. We want to avoid highly processed foods, sugar, white flour, animal processed foods especially, but also red meat and animal foods especially. You gave almost a gout diet, which is a rheumatological condition, right? That's one of the big ones, gout. So eating this way, you also talked about stress management and sleep, not smoking, one of the biggest ones. So wonderful. Guys, I have videos on this as well. I have one on how to eat how to eat more to lose, talks about the red light, green light system of how to classify your foods and eating things that are green, that are strictly plants, green leafy vegetables. You talked about berries and anti-inflammatories, like just so wonderful. So I love everything you're saying. A tidbit about Dr. Celine Lee is that she's so good at what she does. She helps people go from being the Tin Man to having a pain-free life that her patients call her Asian Jesus. She's just so good. So where do we find you, Asian? Move better. Where can I find you? Where can I follow you? I want to just hear more. I want to be in your world and your atmosphere.
I practice at Murray, Utah. It is a city that is about 20 minutes from Salt Lake City. My practice name is Lotus Rheumatology and Wellness Clinic. My website is lotusrheumatology.com, so you can find me there. And also, you can get some, there's an email address there, so you can send me some email if you have any questions.
Awesome. Thank you so much, Dr. Lee. Thank you for spending the time. Thank you for giving us all these tips. Now I know when to send someone to a rheumatologist, how you can make me feel better, and what I can even do to prevent rheumatoid arthritis, such as not smoking. So thank you so much.
Yes. Now it's summertime. I just want to give you one more tip.
Yeah, I love it. All the tips. I want all the tips.
Yes, so a lot of people, when they think about rheumatoid disorder, a lot of people think about lupus. And
Yes.
lupus rash has a very strong tendency of get worse with sun exposure. So, summertime we get a lot of sun these days, and this is the season that I will, advise my patient to make sure that they cover their, wide brim hats and cover their arms with some long sleeve thin shirts, things like that. So. If you have a rash on your cheeks, that's a particular rash of the lupus, the chest area or exposed arm, and you have rash that is really fiery and really look inflammatory and quickly gets worse with sun exposure, then I would recommend to see a dermatologist to see if there could be a rheumatic skin disorder because that's how often the lupus is discovered. So if you have any sun-sensitive rash, then please see your doctor to talk about it.
I love that. Thank you so much. Those are wonderful tips. My patient population is often African American. We see a higher rate of lupus. So if you have a rash that's not going away, or if you have a rash that is sun sensitive, please see somebody about it. Wonderful tips. And also wear sunscreen, cover your skin, wear sunscreen even if you're Black. We all need it. Everybody needs sunscreen. Dr. Lee is a dermatologist, so that's her line as well. So thank you so much. It was a joy having you on. I'm certainly going to bring you back because you have all the tips and we're going to talk about specific diseases. So thank you so much, Dr. Lee, for your time.
Thank you so much for having me.
All right. Bye, everyone. Take care.
Bye bye.
Bye.